of North Hills. Violeta completed her first undergraduate degree in linguistics and psychology at UCLA. She is currently an MS4 at the UC Irvine School of Medicine. She holds a master's degree in medicine, science, and technology studies from the UC Irvine School of Social Sciences in the Department of Anthropology. Presently, she is pursuing a master's in biomedical and translational science to examine cervical cancer screenings in patients who are limited English proficient. As a medical student, she is active in multiple efforts, including co-leading Spanish diabetes education projects that teach medical Spanish, and also in research projects, including those on interpreter use in clinical settings. These projects reflect a passion rooted in her experiences as an ad hoc interpreter as a child for her parents, and also in losing her father to diabetes-related complications when she was in college. She is the founder of the medicalspanish.org website, among other many activities of hers. Violeta, let me start here with you, and hopefully we'll get also Dania soon here to our talk. Can you tell me a little bit about, well, let's start with just the most immediate thing. How did you live this pandemic that we all, experienced? Where were you? In what situation did you find yourself when this pandemic began, if I could ask?
Yeah, of course. So thank you for reading my intro.
Mm-hmm.
At the time I was in my third year of School of Medicine, and we were in rotations, and there was a lot of uncertainty about our education. We actually got pulled out of our clinical rotations. So we were removed from the hospitals, from the clinics, and kind of like our hands-on patient care education was put to a stop. We had no idea when we were going to return and what was going to become of our education. Like, were we still on track to becoming competent doctors? Fortunately, the administration was very quick to come up with creative solutions, kind of turn our whatever remaining coursework into some kind of virtual hybrid. While they sorted things out, there was a lot of uncertainty, like within our own training and also the resident training as well. And of course, the hospital was being overrun by a lot of like sick patients, and they went through several waves of COVID waves. And the hardest one that I personally saw was the people getting together over in December and seeing a huge toll that it took on the ICUs, at least especially at UCI. And at the time I was doing ICU rotation. It was really hard to witness all of that. There was a time where I thought I couldn't do internal medicine because of how like difficult that moment was.
Well, it sounds almost like you were going through a battle, through warfare almost. You were thrust into the situation that was very, very, very delicate and very, from one moment to the next, you didn't know what was going to happen. But can I ask really quickly before I introduce Dania, what was your family, your own personal situation like? I imagine working extremely long hours, and what about your family when you came home? What situation were they in?
At the time, I've been living in Garden Grove, which is, so my family's in the San Fernando Valley. So I actually didn't see my mother or my younger brother for over a year. My brother has a heart condition, and my mother is older and has her own health issues. I did not want to put them at risk. Like I knew that I could not forgive myself, because I know a lot of the patients who came in had these regrets because they got their partner sick, their family member sick. And I know I couldn't, it was too much of a thing to have to bear. So I kept in touch, but I didn't see them in person for over a year.
Yes, and I can just imagine the emotional strain of that, of dealing with so much illness and so many people in a precarious situation at work, and then not being able to sort of provide that comfort or solidarity in person with your family. Absolutely. So now let me introduce our second panelist, Dania Malonado. Thank you so much for joining us. She is also a fourth-year medical student and part of the program in medical education for the Latinx community, Prime LC, at UC Irvine. She grew up in Whittier, California, and attended UC Berkeley, where she majored in social welfare and minored in education. After graduating, she completed the UC Irvine post-baccalaureate program, Currently, she is pursuing her master's in public health at UCSD. Dania is passionate about working with underserved and uninsured communities. She's interested in preventative medicine, community-based medicine, and women's health. She likes to hike, explore new coffee shops, and enjoys watching baking shows in her spare time. So thank you for that. Dania, I'll ask you what I asked Violeta just before you joined us, which was, can you just tell me a little bit about your own sort of personal experience during the pandemic that began in 2020? Where were you, and what was your situation?
Yeah. First off, it's a pleasure to be here. Thank you for inviting me and having me. And I'm more than happy to share. So with me, when the pandemic started, I was actually finishing up my second year and getting ready to start third year. So during that time, it was really hard to kind of transition. During the end of second year, students are required to take our first licensing exam. So we were in that kind of period. So that was difficult to kind of manage and then jump into rotations. So at first, the advice to students was to stay clear of seeing any COVID patients because of the shortage of PPE. So there was a point of time where any patient that was presenting with certain symptoms that were being seen in COVID patients, you are advised to not see. However, that was kind of unavoidable. There were many, many moments where patients would come into the hospital, test negative, and maybe a couple of days later end up testing positive, sometimes, and then being put at risk, which was difficult because during those moments, you kind of enter in a state of panic, like, what do I do? What are the next steps? How do I stay protected? How do I keep other patients in the hospital protected? So those are the kind of things that ran through my mind. And as the year progressed, they gave students PPEs, we got vaccinations, and we learned to adjust during those moments with the different protocols and guidelines. We learned along with the residents and other physicians how the disease was being spread and its symptoms. So it was definitely a big learning moment also, but very scary at the same time. And something that alarmed me was that a lot of Latinx folks were predominantly the people we were seeing getting sick. And even sometimes they wouldn't even have any underlying conditions, yet they would be some of the people who would be in the most critical states, which was very eye-opening. And that was kind of my experience throughout that year.
And can I just ask quickly too, what about your family? How did you and your family navigate personally through this while you were doing all this, while all this was going on?
Yeah. So for me, I actually commute from home. So I commute from Whittier, which is about half an hour to 40-minute drive from where I live to the UCI hospital. And I actually live with my dad, who at that moment was 65 years old. So he was considered more in the at-risk population with underlying chronic conditions. And I live in a multi-generational home. So I have my siblings there too. And I had my younger niece there. So a lot of the times when I would interact with patients and they would bring up concerns of, how do I isolate when I live with multiple people in a household? It's not possible to have my own room and my own bathroom. I was found in that scenario too. And coming home, I tried my best to, if I could, get rid of, dispose of my scrubs at the hospital, clean up my shoes, clean up any of the things that I might have thought were exposed at the hospital. I tried to do that. So I was very rigorous with that, but it was very scary either way, because I felt that even doing that, I was still putting my family at risk. So it was very difficult to navigate.
Well, yeah, it was stressful for all of us, even those of us who were just going to the grocery store, especially those first few weeks, when you had been shut up in the house for 2 or 3 weeks, and you finally had to go out, and just this, the average ordinary person, I think, was placed in the situation of just, of just stress, right, and worry. But that really segues into my next question, which for both of you what's your insight as young Latinx, as Latinx health professionals on how the pandemic impacted our community and our families? What did you see out there that we should know about?
I saw, since I was caring for patients directly, I found myself seeing COVID positive patients, regardless of the restrictions on our side, because there is a big need of doctors and medical students who speak Spanish fluently. And to see patients, I remember spending in like my PPE 2 hours inside of a patient's room and just going over them, telling them about like they had sickle cell disease, but in addition, they'd also contracted COVID. And I was finding myself having these long conversations with people while still, this is before being vaccinated, because there is such a need for us to be present and be there for patients. And I did it at my own risk a lot of these times. And again, seeing it was predominantly Latino patients who I kept seeing over and over, and them getting the worst of it. And still, like, even after the pandemic hit, like, I know it's still going on, but after the release of vaccines, the hesitation, and I got at least an opportunity to write up on that, to kind of express what were kind of the inequities occurring there, the lack of vaccination sites in brown and Black communities, having people to commute long ways just to be able to reach these sites. And even so, like, the hesitation on our people's side to receive these vaccines. And even now, there's still some hesitation. While we've almost addressed the vaccine accessibility, there's still hesitation on whether we have faith in this vaccine.
Wow. Dania?
Yeah, I want to echo a lot of the points that Violeta said. A lot of the times in these communities, it was also needing the support, trying to find the resources to get through. A lot of Latinx folks lost jobs. There was also just a lot of fear of exposure at work sites. And trying to navigate that too is very difficult. So also trying to find ways to connect individual to local resources that were around. I was kind of grateful to be able to connect with a faculty member, Dr. Bilamick, who really did study the Santa Ana community and found out where folks needed help, both socioeconomic, like language services, legal services, other things that also were happening during that time. So being able to connect with communities and help them is really something special, and something that they truly were grateful for in those moments, because there was just a lot of fear, and there still is a lot of fear. And I also want to echo the vaccination hesitancy. It's still present. There's so many people who vaccines are now available. And even, right, if we like look back at the beginning where it was kind of like more of a shortage, like if the clinic that day had some available, then that person could get it. But now that there's plenty, even then folks are still like, I'm not sure, what if this makes me sick? What if this causes an adverse effect? So being to kind of educate folks, but also listening to them, listening to about their concerns, opening that space for them to kind of talk about that, I think, and start those conversations, I think is a more effective way than just kind of telling a person you have to get it or you need to get it.
Right. And what do you think is behind? Is there behind that hesitancy among a lot of people in our community? What is producing that, as compared to other communities? I mean, the question I could ask for both of you, because you both see.
Actually learning this about in my public health courses is understanding more of that historical component of minority communities. The Tuskegee study where, African American folks were exposed to syphilis. And also there's been other studies like in Guatemala. So there's still that worry, that fear that goes back more historically, that mistrust in medicine sometimes and the medical system, that fear of being harmed, right? You come into a situation, you go to a doctor, you put all your trust in them, you're very vulnerable with them, and you only hope that they do the best for you. The providers, that hesitancy might come from there, might originate from there.
Yeah, I think all suspicious of I think a lot of it has to do, but what you're describing is all of this sort of government and sort of officialdom, that's behind this, that people are wary of because those institutions have not always been good to our community, right? So very often, I know both of you have had probably this experience of that in our communities, young people, children are a resource, right? Because children are bilingual and they translate for their parents in all sorts of situations, at the grocery store, the Social Security office, or wherever. How important have children and students, for example, or university students, that generation been in relaying information to the older generations in our community? Have you both seen that at all in your work?
Actually, yes. Last year I started a program that kind of connected kind of younger people with like learning about misinformation and like medicine, and kind of being able to be kind of those agents of change of education for their parents. And during this pandemic time, we saw an increased need to be able to be tech savvy. We had the increased need of having our younger folks help with their parents, try to set up Zoom so they can attend their like appointments, try to figure out and navigate the system of trying to make an appointment for a vaccine, because that was in itself very complicated. And in itself, it kind of excluded a big group if you didn't have like a young person around you, for a lot of our Latino patients, who was able to help you navigate this technology. And PNA Green is one of the nonprofit organizations that focus in the Santa Ana community that put on, and many other organizations did too, like these open forums for community members to participate and ask about questions, concerns about COVID. A lot of people in our community really relied on like anecdotes, stories of like neighbors so-and-so getting a vaccine and getting a bad reaction. So now they were really hesitant. So young people were being helpful in the sense that they were encouraging their parents, telling them about what exactly is the RNA virus, RNA technology, and how does this deal with in the context of vaccines and also COVID-19, because there was a lot of misinformation regarding that, the technology itself. So young people were definitely important and still are.
Yeah, there was this real sort of class bias and assumptions about who the patients were and what they were capable of doing, right? Absolutely. Dania, did you have observations on that question?
Yeah, the same kind of thing that I think throughout, I think young, especially like daughters or sons in our culture, in the Latinx culture, are kind of seen also as like the health mediators in a sense. It kind of feels like more of a role that children kind of play in comparison to more knowledgeable or educated communities. And definitely it was something that I saw in clinics with the Latinx community, but also other communities too, with the language barrier, but beyond that too, with the technology. So, and I think that's just probably going to be a continuous thing, a continuous cycle throughout, which I think is difficult, because I think there has to be other ways, because there can always be miscommunication during those interactions.
Absolutely. Well, sometimes in my experience as a journalist, in covering different crises, I think that I've learned that a crisis can teach a community something. It can also show a community something about itself. You know, it can show us the strengths that we have as a community, or it can also show where we're weak and where we, you know, where we're disadvantaged. What has this crisis, has it shown us anything about differences between the Latinx community and other communities in their understandings of what health and wellness should be and are?
That's a tough question, but I'll take a jab at it. It's just that as a Latinx community, we're very united. We're very like family first, and it really taught us to kind of like be more mindful of like, because we love to get together, and that's how we celebrate like life and all of our holidays. But it really kind of forces to kind of re-examine like our what we value as family, and kind of like be able to kind of still find a way to social distance but still remain connected, so to kind of maintain our family values but do it more safely. And I still see like predominantly like Latino patients are still like following a lot of the precautions, as opposed to the alternative other patients who are kind of like, I'm over it, I'm over wearing these masks. But they're
Right.
still like, we're like Dania mentioned earlier, we're likely to live in crowded housing. We don't have the privilege of social distancing. Early in the pandemic, the data showed that majority of like Latino households did have one at least essential worker. So the likelihood of us bringing home the exposure is a lot greater in like in our communities, and we live more in crowded housing too.
Dania.
Yeah, this is a really great question. I think the Latinx community is very resilient. Just to start off, pandemic, no pandemic, it's a very resilient community. And I think sometimes we don't give ourselves enough credit when it comes to hardships and the things that we go through. But what I really appreciate is that sense of community that's never lost, whether that be in the workplace, whether that's at home. You know, I like what I kind of witnessed too in like working in clinics or being in the community was people supporting other people. If somebody got sick, and it was a neighbor, you know, I had an example where one of my patients, she told me about her neighbor. She's a single mother. She has children at home, but she got sick and couldn't care after her children because of that isolation period. But her being her neighbor, she kind of helped with the child care, helped in the rearing. So that's kind of like a way where that community really becomes important, where we support each other. And I think that's such a great value, and something also that sometimes we take for granted, but can be critical in times of crises, such as a pandemic.
Well, I think I want to ask something too, just from what you were saying. Maybe this is more personal, but was there a time in this crisis, which really is sort of still ongoing, but that you felt especially proud of someone that you in the Latino community, or proud of our community? Was there a moment, you know, when you just really felt like, así somos, you know, and because we're this way, we're going to get through this? And conversely, was there a moment when you felt especially frustrated, like, ay, señora, you know, what are you doing? Is that, you know, I just wanted to sort of ask that very personal question, if there was a moment of pride or a moment of frustration that you remember.
Sure. I can tell you the moment of pride. a few months back, so the MPNA Green has been putting on vaccines sites, pop-up sites at their Madison Elementary School. The next one's actually this Friday from 4 to 8 p.m. for anyone who hasn't been vaccinated or has family members who still need to be vaccinated. So 4 to 8, October 15th, at Madison Elementary School. But like, I remember like going to go volunteer, and then I went in like at 6 p.m. It started at 4, and there was this huge line, and they're like, just getting here. We need you to vaccinate people. Like, to me, that was amazing to see all these people waiting in line after they worked long hours, bringing in their kids, seeing mothers saying like, oh no, it's his turn, like bringing in their kids over 12 years of age. And I'm like, it's their turn. I'm already got vaccinated. Like, we're here, get them. And I think I really like that kind of like made me feel like, okay, there is an end, there is some like, you know, an end to this. And then we're seeing our people really like come through and like spend all these hours just to get this vaccine. And that was really like, okay, like we're gonna be okay. There may be a little bit few more dark days ahead, but we're gonna be okay, because like Dania said, we're very resilient. And as far as the saddest moments for me, it still goes back to January. Like, I think I just seeing so many like Latino patients in the ICU, and just because they, you know, we love to get together over the holidays, and just seeing them, you know, go from having a wonderful New Year's and like a Christmas to now being in the ICU and on 3 pressors, on the continuous dialysis and multi-organ failure. That was really heartbreaking. And seeing people coming in, being verbal, talking, and kind of helping them flip over so they can breathe better, and then a few days later, like their lungs look terrible on their imaging, and just constantly having to tell their partners on the phone who can't see them, like, I really don't know what's going to happen. Like, one day they'll look fine, and next day they can end up just being crashing and having to be intubated. And I can't tell you the percentage of of their chances of making out of this. I think that was continuously heartbreaking, and it was always seeing like our people being intubated and dying. That was really hard.
Dania?
Yeah, something that I really admired. So in the Santa Ana community, they have promotores, which are community members who kind of go to different homes throughout the Santa Ana community. And during COVID, even with, you know, the uncertainty of exposure, they still made it their goal to reach out to communities, come to them, provide services to them, or provide just information. And to me, I'm like, that really resonated with me, and also kind of showed me like, wow, what a strong support system that can be found in the Latinx community. And then another thing too is how, for me personally, was the admiration of when I would see Latinx physicians in the front lines. And it made it that much more meaningful to me, whether that was like in the emergency room, in the internal medicine wards, in the ICU wards, like just seeing folks, knowing that there's Latinx physicians in those different areas providing support, yet they were so limited, but yet so needed, you know, to me, even kind of fueled my flame more into becoming that physician. Because now I'm like, I want to be able to do that. I want to get to that point where I can provide care and help others to get to that point, so that when things like this happen, crises like this, that it's not just one Latinx physician in that department, right? That it's not just one Latinx in the ICU or one Latinx physician in the emergency room, but multiple, because there's such a need, because our communities, you know, are now becoming the majority.
Yes, and just putting yourself in the perspective of a patient, of a Latino patient, especially one of working class background, to go into this place where you're already afraid. You're facing this, this health emergency, and you're in this position of vulnerability, and to be in that position of vulnerability, and then be able to see someone who speaks your language or someone who understands your culture. I mean, it just speaks to me to how important the work you both are doing is to our community and to the state, as you say, because California is increasingly a Latinx state. So thank you both for all the hard work and sacrifice that you've put in so far, and I can imagine it just makes it, just an affirmation of all your hard work. So thank you for that as a citizen of the Golden State. I want to mention that for those in our audience, that there's a Q&A button. So I'm going to ask a couple more questions, but please, press on the Q&A button and type in a question for us, and I hope we'll be able to get to those. So please type away questions in the Q&A. But for my next question to you both is, what do you think that the medical profession needs to do better to reach Latinx families? And especially in the light of this crisis, what have you seen that the medical profession in general needs to do better?
I think it really begins at a much younger age. Like a lot of organizations are trying to get more younger Latinx youth interested in medicine. Just recruiting more from within our communities that's a start. And once we're in medicine, for those of us in medical school, ensuring that those of us that do come from these communities who've had a lot of struggles, like that we make it through, that we're not alone, so that we can become the physicians that can come back to this community and really like help out. They are programs that are mission-based, that are made for the community, but we still need to target more the individuals who actually came from these communities. Because they're the ones that historically will go back.
Dania?
Yeah, I agree with Violeta. I think trying to increase the number of Latinx medical students and supporting them from the early stages too. I think there's always that idea of starting from college, but it should be so much earlier than that. To me, I think it should start from elementary school. Slowly kind of bringing this idea of what is science, what is health, what does that look like, and fostering that kind of passion in those children. And throughout that way, seeing mentors, people that look like them, people who come from their same communities, because that's going to be key and important as you get to higher stages of education. I know for me, something that really spoke to me from one of my mentors, that she told me, she's like, the higher you climb in education, the less of you you're going to see. And to this day, that has stuck with me because it's so true. From going to med school where you're in a class of like hundreds of students and only seeing a small percentage of that, to then entering the wards, being in the hospital and working with very, very few Latinx physicians is very striking. And that's something that I wish we could do a better job. But also even within the communities, I think listening to communities, partnering with communities, finding out what are their needs, what's the best way to support them. I think a lot of times we try to intervene and put interventions that we think are best without actually listening. And I think those are kind of good starting points to support the Latinx communities.
You also brought up another important thing, like recruit more faculty that look like us. You just mentioned it yourself, there's not enough of us in the hospital.
Well, also it touches to me that wellness isn't just to become healthy. It's not just a matter of science or even just medicine, it's a matter of a state of mind and entering into an awareness of yourself. And that when you have people who understand your culture, it just makes it so much easier to begin that journey. I mean, I'm a heart attack survivor. I had a heart attack a couple of years ago, and I had to learn a whole new way of living. And my ability to have those conversations with my doctor, to trust him, and not only my doctor, the nutritionist, and all the people who were talking to me about my health, that to my ability to communicate and trust them kept me from neglecting myself. So when there are more Latino health professionals, when there are more instructors, and there are more, it just makes those positive outcomes more likely. And I think you've both seen that already. You've both seen that already. So my last question here before we go to the Q&A from the audience, which have a couple of questions, is are there any trainings that your specific organizations or the institutions that you work with that they offer to help medical professionals, or to help the medical profession better reach the Latinx community? Are there any sort of trainings going on out there in that regard?
I'll let Dania go first, since it's Prime LC.
Yeah, so Prime LC, which is a program in medical education for the Latinx community. So through this program, we're in cohorts, and the cohorts kind of vary from like 10 to 16. And part of our training is that we learn how to take histories and do physicals in Spanish, something that's very unique that not all students get to learn. So part of the requirement for the program is being able to speak Spanish, so that you're able to learn how to do those, conduct histories, do physicals. So that's kind of where we first start out. And within that, we also have Chicano Latino Studies course that we take throughout all our 4 years. So it's various classes, and it starts from the summer that you start all the way to 4th year. And so like last year for me, during the clinical year, every month we had one class session. So during those classes, we're assigned readings to learn more about the culture, learn more about current events too within the Latinx community. So when COVID was happening, some of the readings that we were given were focused on COVID, which I thought was something that was very important. And I was actually really grateful and glad that our readings were actually being more current, because there were things happening that we needed to be informed of. So those are kind of ways within the program that helps us be more competent when it comes to working with the Latinx community.
We also have the LMSA, which is Latino Medical Student Association, which is open to anyone in the class. And they put on they have a lot of great resources. One of them is that they put on, it's a student-run medical Spanish elective that the students who already have like maybe a basic Spanish understanding can kind of expand on their medical Spanish, so they can feel like they can maybe help out more in like in informal settings in a clinic. And they also put on like pre-med conferences to kind of get more of the younger college students, the Latino background, interested in medicine as well, and other opportunities. So we have that great organization within our School of Medicine as well.
Fantastic. So now we have a couple of questions here from our audience. One from an anonymous attendee who says, MS2 here. Is there anything you want your non-Latinx identifying classmates to know? Or is there a way where we can help better support y'all on your journey in medicine? Our panelists?
I think, something that that I think our school needs to do better too is just opening up kind of the education on learning about different communities to all students. I know it's always something that's kind of put on us, like if you want to learn more about the African American communities, learning about their barriers in healthcare, it feels more like it's put on us rather than the school. So I kind of wish the school would do a better job at, if they really want to help us be more culturally competent with working with diverse communities, then that could be very helpful. But I think being able to also take that initiative oneself to learn more about different communities will not only make you a better physician, but you'll build better relationship with patients that way too. I think that's a way that hopefully I answered that question. But those are kind of ways I can think of.
Thank you.
I agree with Dania as well. Yeah, like it shouldn't just fall on us as the minority students to run every minority initiative or being responsible for it. Like, for example, for Hispanic Heritage Month from September 15 to October 15, it shouldn't fall entirely on our few Latinx students to put on the events for it. It should be the school or the school's mission-based programs who are supposed to be representing this community to be the ones initiating these events. We should only be there as more of a support. It shouldn't always fall on us to be the representative for our communities. It's exhausting because we're doing this work on top of our regular academics and trying to publish also too, so that we are seen as good applicants for residency programs. I remember putting in so many hours creating educational graphics, and I could have been studying for my board exams. I should have been studying more for them. It's just like having to balance these I guess this hidden curriculum that people always talk about, like the minority tax. It's expensive, and it's we really would like appreciate the help.
Wow. Here's a question from Marta Lopez, who asks, how do you guys cope with the overbearing pressure or stress of helping our Latinx community, especially during the pandemic? So how do you guys cope with the stress?
Like for me, I have to sometimes step back and not do every single outreach activity, which was really hard because I'm like, we want to be there. We want to do as much as we can. But I'm like, sometimes I'm like, I just need to recover and have more energy for myself and think about my own wellness, because we can't do everything as much as we want to. We want to make sure that we make it out of here at medical school with still being healthy, still wanting to continue the fight, and trying to get more other people to help us out too.
So thinking of your own mental health is extremely important. You can only be as effective as healthy as you are, Dania?
Yeah, I echo what Violeta mentioned, that putting yourself as a priority is key. It's already really stressful, medical school, trying to navigate the whole medical education yourself as a first generation student, as a minority student. That's a lot of weight already on you when you first start medical school. And when it comes to events and trying to get involved, it's so easy to over involve yourself because you're so passionate. You're like, I want to do this. I want to learn about that. I want to be in the community. And it's so easy to kind of let your mental health and well-being slip by. And I think just in general, the whole medical, like being a healthcare worker is already very difficult and very stressful. And I know that our medical system still has a long way to go into incorporating and helping build more around wellness, physician or healthcare worker wellness. But a thing that helped me too was just talking to other folks that weren't in medicine, whether that was friends or family, to kind of share with them maybe the experiences that I'm going through. I always go to my dad or my older sister, and even though they might not understand everything, just kind of allowing yourself to, give voice to those thoughts, is also very therapeutic in a sense.
Mm.
But always making sure you have wellness and you create space and time for the things that you like. And for me, family is key. So if I don't see my family or if I don't talk to them for more than a week, for me, that's just not good for my wellness. So having those moments is important.
Wow. I mean, that's sort of the stereotype of the medical student, is of someone totally cut off, from their family network, off, doing this incredibly taxing, time-consuming thing. And they leave for years and they come back and they've aged from exhaustion of all they went through, But you're saying that your family has to sort of go along with you a little bit on this journey when they can. Yeah.
Yeah, since I live at home and I commute, my dad's witnessed, kind of all the ups and downs of what a medical student's life is kind of like, like sometimes when you're asked to be at the hospital at 4 a.m., I leave before everyone's up, or I come back home when everyone's asleep, right? When we have to do night calls. So in a way, for me, my family's also kind of going through that roller coaster with me. And I hope that, in the future, for other family members or friends, I can help be that guidance, because I know how important that is for me right now, having mentors that look like me and providing me advice. And I think I just hope to do the same for others in the future.
Violeta, I see you nodding there. Did you want to add something more to what Dania said?
Yeah, right now I'm applying to residency programs and I'm thinking, oh, this is a place my mom will be happy because she's going to have to come with me or be in some place where like I know that she'll be willing to visit me, or I can fly her over and make her live with me. So
Wow.
I miss being at home. Like I really do. It's just, like as a daughter of like, it's a Latina family, like the daughter never really leaves home until she gets married. So for me to not be home and like, it feels like I'm not fulfilling my daughterly duties to being like a good daughter and living at home. And I just miss like my family so much, but I know that all of this is only temporary and I can go and take care of them, and wherever I end up, that is a dream.
Well, we have one more question here from the audience, which is one we touched on a little bit. How should I approach an acquaintance who is hesitant to get vaccinated? Your thoughts on
Dania
that?
touched upon this earlier, like being there to listen, being able to listen to why people are hesitant, as opposed to immediately jump in with that guidance, that advice, or like give you again that complicated scientific breakdown of how the vaccine works and how it's not gonna make you magnetic or put a chip in your brain. Like first listen to where they're at and kind of start from there.
Yeah, there's actually an article, there was a study actually done on hesitancy in COVID-19 vaccinations for both the Latinx and African-American community. And one of the advice was just creating that space, listening, because sometimes it might just be like, well, I'm afraid to get an allergic reaction, right? And then you can explain, well, like in the vaccine, these are kind of the components, the things that are made up for it. Or getting sick, right? What do symptoms from vaccines look like versus an actual illness? And sometimes it's just helping, like guiding them through that information. Because a lot of the times it's just word of mouth. And you don't know if that's a credited source or not. So I think first off is just opening the space and saying, well, can you share with me, what are your thoughts around the vaccine? What are you worried about? What are your concerns? Before being like, no, you have to get it. Everyone's getting it, like, so yeah, creating that space and being non-judgmental.
Wow. Well, our hour's almost up, but I just wanted to make one last observation, and you can tell me if this is correct or not. But my observation from our conversation here over the past almost an hour is that going through this crisis is going to help make you both better health professionals, right? And the other thing I was going to say is that it's also going to make our community, we're going to learn lessons from this as a community that are going to make us healthier. So that was my observation. I also want to leave it for you to make any last things you want to say to our audience.
Like, it's understandable for people to get overwhelmed with the amount of information that comes out daily through the CDC. Like, I don't know if anyone's ever gone to those comments, like on Facebook, people are overwhelmed with the amount of information. They don't no longer know how to take it. For us who are in healthcare, who are pre-med or have a better understanding to be able to digest this information for our family members in our community, like, that's how we can help. The great thing about technology and research is that we have advanced so much to be able to produce vaccines so quickly nowadays. The bad thing is that with the amount of communication that we have, and last year being the pandemic, where it was its height, we saw the most people connected online and social media, is that we have so much dispersal of information, and unfortunately not all of it is true. So our responsibility as people who are in higher education, who have a better understanding of all of this, is to be able to digest that information and provide it for our community in appropriate language, in the appropriate level, in the appropriate context.
I think advice I would want to just share with everyone is just never lose touch of your roots, or your communities. Those are the places that helped you and shaped you become the person that you are or will be in the future. So don't lose touch of that. And if there's ways to stay connected in the community, do so, but also know to limit yourself, right? Because if you have a goal in mind, if that is to become a doctor, become a nurse, become a teacher, right? You want to make sure that you achieve that goal, right? Because in that sense, you'll help your community by getting to those places, and increasing the number of Latinx professionals in various fields. So kind of know that limit and always ask for support and advice along the way. It's so hard. That's something that even now is so difficult, whether it's peer-to-peer or to me, I'm like with physicians, it's still very hard for me to be like, can I just have a moment of your time to ask you some advice for, what this physician looks like, what your day-to-day life is like, how you find wellness within being a physician. Can be very hard, but sometimes you just got to take that leap of faith in a sense, because you never know what'll happen, what relationships can manifest from those moments.
Well, thank you. Thank you for your eloquent words, both of you. Thank you for your service to our community and to all of your patients and to your families. And thank you all for joining us in this wonderful event. Thank you to the people at the School of Medicine who helped put this together, and also at the Social Science Activities Research Center. So thank you all and have a good evening. Good night.
Thank you, everyone.